Hi, I'm Gemma, one of the health visitors. I'm one of many health professionals who give advice around safer sleep. It's Safer Sleep Week, so we're going to talk a little bit about the safer sleep advice that's given to families with babies under 12 months. My little friend here to help me explain a little bit about the advice that we give to families, but also why we give that advice as well. So when I talk about sleep, I mean all sleeps, not just the nighttime sleep. And we're talking about preventing some of the known triggers for sudden infant death syndrome, for SIDS. So we advise that babies are put on a firm flat surface on their back, that the cot is clear, free from any toys and pillows, duvets, cot bumpers, any props. We advise that babies sleep in the parents' room for the first 6 months. I'm going to go through a little bit about why we give the advice that we give as well. Okay. So a firm flat surface, by placing a baby on their back on a firm flat surface, that really opens up the lung capacity. There's lots of airflow around the baby's nose and mouth, and they have full lung capacity, nice and open, so that they can breathe nice and effectively. We advise that they are not propped in any way, and the reason for that is that babies who are propped on a gradient in any way, whether this is something underneath them directly or underneath the mattress or underneath the crib, we wouldn't advise anything like that, because the baby's chin can drop down and they can squash their own airway, or they can reduce the amount of oxygen that they're able to breathe, and babies who are low birth weight, small babies, premature babies, babies who are unwell, are more susceptible to this happening. So we don't want the baby's chin to be squashed down towards their chest. We want it nice and open. We want to really increase the lung capacity so that they have a lot of oxygen to breathe. Most of the advice that we give around safer sleep is around really optimising the oxygen levels that the baby can take in. So we advise to put them feet to foot, so that their feet are to the bottom of the crib or the cot. This is to stop them wiggling down, as we know babies can do. We don't want them going underneath any covers. We want the covers to come up to the nipple line here and to be tucked in nice and tightly, so that the blankets aren't free and able to move over the baby's face. One of the reasons for this is that babies can rebreathe their own breath, and that rebreathe is one of the triggers, the factors that we know can contribute to SIDS. So we know about suffocation being quite tight over the nose and mouth. That can occur with cot bumpers, with toys, with blankets, being held in a parent's arms, sofas and settees. But we also consider anything that is within the vicinity of the baby's nose and mouth. If they're rebreathing in their own carbon dioxide, then their oxygen levels are going to lower, and we know that lower oxygen levels are a trigger for SIDS. So we've got our clear cot, no pillows, no cot bumpers, no teddies. The covers are tucked in nicely just up to the nipple line, and the baby's feet to foot. We're not going to prop the baby or put them in any other position than a firm flat surface on their back. So we've been advising to put babies on their back since the 90s. We knew that before that around 1,500 babies would sadly die of SIDS a year. And we now know that babies sleeping on their back are much safer, because straight away during the 90s, when that campaign, the Back to Sleep campaign, took place, the numbers of SIDS started to reduce dramatically, and since then have been sitting around the 250 to 300 per year, rather than the 1,500 that was occurring before. Now, some of the reasons for this, and I know this is one of the challenges that we have when we're talking to families, when a baby is sleeping on their front, they tend to go into a bit of a crunched up, bottom up position. This puts pressure on the lungs. You've got the weight of the lungs and the heart going down because you've got gravity. So their lung capacity, their ability to breathe is compromised slightly. Babies naturally turn their faces to the side, which is good, but their face is still on the mattress, on the sheet, and they still have a little bit of that effect of the rebreathe. Plus, also, some parents feel that if babies are sleeping on their back, that if they vomit, they're going to choke. And that's the opposite that's actually true. So when babies are on their front, the way that the airway is aligned with the esophagus, if they're on their front, Any vomit coming up from the stomach is now above the airway and can trickle into the airway, causing a choke, as well as any pool of fluid that they might then have around the nose and mouth. When babies are on their back, you have the airway above the esophagus, so anything coming up gravity's not going to trickle that down into the airway, so they're less likely to choke when they're on the back than they are on their front. And babies naturally turn to the side, and that would normally come out and pull, but be away from the nose and mouth. Also, overheating is a known trigger for SIDS as well, so we wouldn't advise that babies are wearing a hat indoors at all. It's not needed. So babies expel the heat through their head if they're getting too warm. If we cover the head with a hat or with a blanket or anything else, we're taking away one of their survival mechanisms of being able to release heat from the body. So to recap, we want a firm flat surface, we want feet to foot, we want a clear space, we want all this oxygen, all this air to circulate nicely around the baby, we want this open lung capacity. We don't want the baby to overheat by having anything in the cot, by having hats on. We want them to be at an optimal temperature, around 18 degrees, normal room temperature. We want the blankets up to the nipple line so that they're not snuggling under the blankets or the blankets coming up over the face. And we want them to be in the same room as parents for the first 6 months. And we give this advice for all babies up to the age of 12 months. SIDS tends to occur between 2 and 6 months. That's the prime growth development age that SIDS can occur. I think a lot of parents feel that they're very protective in the first few weeks, and then this complacency can settle in, or as the baby gets older and able to move a little bit, then sometimes safer sleep practices are reduced. So we want this practice to continue right from birth up to 12 months. Thank you.